Hi, and welcome back to lesson number 22. This is the Stop Smoking Arsenal. Even if you don't smoke, you've never smoked, or if you've quit, it's important to be educated about smoking and even vaping and marijuana. So first, we're going to talk about smoking, what smoking really does, and how to quit if you haven't yet quit, and how you can even get someone else to quit. Here's the secret about smoking that no one else tells you. I'm going to give it to you straight. You ready? The tobacco that they use is a processed tobacco, and it contains all kinds of chemicals, most of them carcinogens. They're designed to burn evenly and burn at a certain rate. What tobacco also has in it is an enzyme. Enzymes digest things or break them down. And these enzymes in the tobacco break down the cells of your lungs. Literally, digest your lungs very, very slowly. So what happens is someone who smokes for a long time, they get more and more short of breath, they have a hard time climbing up a flight of stairs, and they just chalk it up to getting older. Nobody told them that cigarettes, meaning tobacco, contain an enzyme that literally digests your lungs. So every time you cough, you're coughing up microscopic pieces of your lung. So you can call it smoker's cough, you can call it whatever you like. I call it you're losing lung tissue every time that you cough. And I'm not afraid to tell people who I see smoking that they're slowly losing their lungs, literally. If you've already quit, congratulations. If not, there's support available at 1-800-NO-BUTS in the US. There's also help at www.quit.org.au for Australia, quit.org.uk, quit.org.nz or NZ as they say for New Zealand, and iqssouthafrica.com. You can go to numerous places and log on and get a lot of help. And just why do people smoke? Smoking releases dopamine, which is a pleasure chemical. And nicotine is a very addictive substance that stimulates the central nervous system. Nicotine also raises fat levels in the blood, and some studies show that it can lead to diabetes type 2. And nicotine withdrawal is most unpleasant, taking up to 4 weeks to get through. Peak nicotine withdrawal is felt at 2 weeks, but nicotine is not what makes people sick. It's the smoke, the tar, and the additives that will give people COPD. So some issues that come up with quitting are, first one is weight gain. You can anticipate gaining about 8 to 12 pounds, but realize that you will then have the ability to exercise to counteract that. And then there's the anxiety of withdrawal. So without the simultaneous effects of nicotine, which is a central nervous system stimulant, and the relaxation effect, it's hard to know what you need. So just hang in there and stay determined. You will live longer and make it to family events, meet the grandkids, and all that kind of thing. So how do you quit? Quitting is hard. There's absolutely no denying that fact. There are many methods for quitting. Some people successfully quit using just 1 or 2 methods, but not many people stay quit using just one method. Smoking itself needs to be addressed from many angles. From the physical side, the unhealthy part, there's immediate effects of smoking and there's the long-term effects. The immediate effects are raise in heart rate and blood pressure, and of course the long-term effects of COPD and other lung issues. There's the social aspect. You have friends who smoke and friends who don't. So is it okay to go outside and smoke versus is it okay to smoke inside and together with your friends? Most of the people who are social smokers go mostly on social cues. They don't go on actual addiction. There's the emotional aspect, just a need for something to be able to relax. Then there's the chemical and physiological part, which is the addiction to the nicotine. There's the mental aspect. Many people need a cigarette just to wake up, kind of like a lot of people need a cup of coffee. There's the intellectual part, because now we know cigarette smoking is bad, but we're addicted and we're helpless to do anything about it. Then there's the question, is cigarette smoking a habit or is it an addiction? Generally speaking, if you smoke less than 5 cigarettes per day, it's a habit. If you need more than 5 cigarettes per day, it's an addiction. And I had a patient once, this is a true story. She was in pulmonary rehab with me. She'd quit smoking about 30 years ago, but she said, for the last 20 years after she quit, she said every day after dinner she would go to the drawer to get her cigarettes. which of course weren't there because she'd quit. But she said for 20 years she went to that same drawer to get her cigarettes out, just like she had done the 30 years prior to that. So it's definitely habit forming, and if you smoke more than 5 a day, it's definitely considered an addiction. It's very tough. So again, getting the support that you need. You can call your insurance company. Call and see what they have to offer. You may be surprised. Sometimes you call and they say, oh yes, we have an entire quit smoking program that you can get enrolled in for free. You never know. There's, again, 1-800-NO-BUTS. There's 1-800-QUIT-NOW numbers in the US. Talk to your employer. Your employer may have an employee assistance program that includes a smoke enders program. Talk to your doctor. He may have somebody in office or a program that he can get you to that will help you. There's also other websites, becomeanx.org, smokefree.gov, quitnet.com, and in Spanish it's 800-45-NO-FUME. So if you have Spanish-speaking friends that can't quit, you can direct them there. So how many times have you tried to quit? The past does not equal the present. So if you've tried many, many times to quit, it doesn't matter. What happened in the past is not the present. I give you the green light to go ahead and please, please try again. So what about nicotine withdrawal? There's very unpleasant withdrawal symptoms. And what I tell people is, the weight gain part is reversible, but COPD is not. And I'm going to say that again. The weight gain part, when you quit smoking, that's reversible. But once you get COPD, the chronic obstructive pulmonary disease, that's not reversible. And nicotine withdrawal is survivable, both for the smoker and for their non-smoking friends and family. And for the stress management, there's many options available that weren't available years ago. There's also newer drugs available, there's hypnosis things available, there's patches, there's gum, and I'll talk about those in a second. Now, before we get into those, what if you feel you're just not ready to quit yet? You need to believe 3 things. You need to believe, number 1, that smoking is unhealthy. You need to believe that you will feel better after you've quit. And you need to believe that you can do this. It's not impossible. Scratch out those letters, I am. It's very possible. You can quit. You will feel better after you quit. And I don't have to tell you, smoking is very unhealthy. One of the things that you can do to help is to visualize. Identify something that you believe you can do in the future, but you can't do now because you smoke, whether it's riding a bike, golfing, taking a walk. So make the commitment. Make the commitment to all the alternatives, to some temporary stress, some social confusion when you're around friends that smoke and friends that don't. They will still be your friends if you quit. Just like your non-smoking friends are still your friends, even though you do smoke. So are you ready? There's some things we need to ask, such as, is now the right time to quit? Are there any major stressors or changes going on? What about work? Is work stressful? Are you looking at a promotion? Are you constantly worried about your job security? What about your family? Is there a wedding coming up? Is there anything going on in the family? Are you worried about a job loss? Did you recently lose a job? How are your relationships going? What's home life like? What about people that you live with or roommates? Are they all smokers? What if your spouse is a smoker? Is there any alcohol or drug dependency going on with you? So take a look at all these things. Maybe now is not the best time to choose to quit. You could work through a few of these things on the list first and then decide if maybe now is a good time to go ahead and stop smoking. Now we'll talk a little bit about drug therapy. There's 3 classes of drugs to treat tobacco addiction. So there's nicotine replacement therapy, which is the patch. I don't endorse any particular kind of patch, but there's patches, there's drug therapies. Chantix is a very popular one. The biggest side effect of Chantix is nausea. And Chantix should also be started a week before you plan to quit. What Chantix does is it lessens the effects of smoking, in other words, the buzz. Other reported side effects are suicide ideations and heart problems. So you want to be careful with those. And another common drug is Zyban, which carries an increased risk of seizures. So you want to be careful about just going and getting some drugs, some pharmacological therapy to help you. There's also gum, which helps satisfy the oral cravings, and gum needs to be titrated to manage the withdrawal symptoms, which remember peak at 2 weeks. You want to chew the gum slowly, and you'll feel a tingling. And when you feel the tingling, stop chewing and just kind of park it for a minute. When the tingling fades, you want to chew again. Don't use this while you're eating or drinking. And in fact, you want to wait 15 minutes before eating or before drinking when you're going to use the gum. Now, some people prefer the patch. The patch is a little difficult to titrate, and it can cause some redness at the patch site, which usually they treat with cortisone cream. So if you buy some patches, make sure you buy some low-dose cortisone cream too. Other people use things like lozenges, which side effects include heartburn, hiccups, and nausea. And some people use nasal spray, and some people have reported throat irritation and nasal inflammation with that. So pick your poison, literally, to help you get started to quit smoking. Now there's some additional resources, including some really good reads. There's a book called The Smoker's Book of Health by an author named Tom Ferguson. There's another book called Quit and Stay Quit by an author named Terry Rustin. And if you just go on Amazon like I did here, I just did a search for stop smoking. And these books came up, this one. There's about 7 pages of books that came up to help you quit smoking. But I do recommend the first 2 that I mentioned, The Smoker's Book of Health by Tom Ferguson and Quit and Stay Quit by Terry Rustin, who is a doctor. Now, one of the things that is important too is to keep track of your milestones, keep track of your successes. What if you went so many hours without smoking, and then those hours turn into days, and then those days turn into weeks? Just keep trying. You know those signs that you see at a lot of workplaces that says, you know, this many days worked, this company has gone, 17 days without any kind of an industrial accident or something. Make yourself one of those signs. Days smoked free. I've gone 5 days now smoke free. Oops, didn't work. Okay, start back at day 1. But just a reminder of your successes, not so much of your failure, but that you made it that many days smoke free. Same thing on a calendar. Mark an X for something for every day that you didn't smoke. Just keep track of your successes and really look at them as wins for you. Now I'm going to throw in a little fact here. There are 2 interventions for patients with COPD that have been shown to increase the life expectancy. Number 1 is quitting smoking, and the second is using oxygen if you need it. And that's described as a resting saturation of less than 89%. So if you're on oxygen, I'm pretty sure your provider talked to you about the dangers of smoking around oxygen. So don't do it. And again, this is for people with COPD. Stop smoking and use that oxygen. So some more reasons to quit smoking. If you do not have COPD, you're simply a smoker and haven't been diagnosed yet. The cilia, which is the little hair-like projection in the lungs that keep things moving north, if you will, the cilia function return in 1 to 9 months. So what that means is when you smoke, the cilia freeze. They just get paralyzed, and it takes 1 to 9 months to get that cilia function to return. And again, that cilia moves a thin, clear layer of mucus north, if you will, to keep out dust and debris and pollution and things like that. So without that protection, when you smoke, you're subject to a lot more inhalants and things that are really irritating to your lungs. Another thing that happens when you quit smoking is your circulation will improve in somewhere between 2 weeks to 3 months. So smoking does affect the heart, and your lung function will improve in 2 weeks to 3 months if you quit smoking. So that's another reason to quit. So a total time to return to a non-smoker's lung function, again, if you do not have COPD, is 15 years, depending on how long that you've smoked. So just remember that. Little lung damage, you don't notice it, you don't feel it right away until all of a sudden the cumulative effects come on. So some more resources for you. At the last check, the Affordable Care Act allows 4 10-minute sessions and allows all FDA-approved tobacco cessation medications, prescription and over-the-counter, to be used twice per year. So that can change in any minute as of this recording, but apparently that was written into the Affordable Care Act. Your doctor can likely steer you to something that will help you, that may include some counseling sessions. It may be in person, it may be over the phone, depends on what your insurance covers. Now, another interesting fact, you can volunteer for a study. Research discovered that volunteers who did stop smoking studies, they're more likely to quit. There was a study using combination therapy of a patch plus the bupropion, which is a Zyban, showed that 35% of people stayed quit at 12 months. So if you're having a particularly hard time quitting, find yourself a study and get in. There's lots of studies available. You can just do a search for stop smoking study. Smokefree.gov has studies. There's lots of things available to you. Now, some other possibilities for quitting include hypnosis, whether it's an in-person with a hypnotist. There's a lot of hypnosis MP3s that are available online. You can download them and you can use them right away. And as I recommended in the module on stress, I recommend Dr. Steve G. Jones' products. And here's a hint. If you go to Steve G. Jones' website, register and buy one download, you'll get on their mailing list and you get notice of $1 sales every now and then. So just go on. Shh, I didn't tell you this. Buy one, get on their list, and you'll get a notice that they're having every title on sale for $1. They're really, really good. Now I want to talk to you about the COPD that no one really talks about. Now most of my patients, I would say, they're about 70 to 75 years old. If you're not yet 70, don't drop out yet. Just stay with me here. So now it's 2016, so that means most of you were born right around 1940, give or take. So if you were born in 1940, that means in 1965, right in the middle of the 60s, you were about 25 years old. And I'm not saying this to incriminate anybody or accuse anybody, but probably once or twice you were surrounded by marijuana. I have a lot of patients who tell me, oh, they never smoked cigarettes, but they leave out the fact that they smoked a lot of marijuana. Marijuana back in the 1960s was a lot less potent than today's marijuana, but it still had resins and lots of gluey, sticky stuff in there, and largely was used unfiltered. So what that means is all that gluey, sticky resin got to the bottom of your lungs and kind of glued your air sacs together. And that's why you got COPD, even though you may have never smoked a cigarette a day in your life. So just be aware, just because you smoked something natural and it wasn't processed like tobacco, there's still a lot of resins and glues in there, and it still does a lot of lung damage. Is that damage reversible? Well, potentially. If you're still smoking marijuana and you stop today, you may discover in a couple days that you develop a cough, a productive cough. And if you allow yourself to cough up all the mucus, resins, and particulates, you may be able to avoid some damage, and you'll breathe better. If it's been a number of years since you last smoked, then I'm sorry to say the damage has been done, and likely you've just coughed out all you're going to. If you're still using medical marijuana, just beware. It contains the same resins and oils, and it's much, much stronger in terms of THC content. Now on my blog, I have an article about vaping, which is using e-cigarettes. There have been many success stories of people who got themselves off of cigarettes by using an e-cigarette or electronic cigarette. But e-cigarettes still contain nicotine and a substance called propylene glycol. And a recent study showed that the substances in e-cigarettes prevent the body's natural defenses from fighting MRSA, which stands for methicillin-resistant Staph aureus. It's a very, very bad bug. And recent research has shown that many of the flavored liquids contain something called diacetyl, which is a compound implicated in popcorn workers' lung. That certain smell of microwave popcorn, that's the fake buttery flavored oil, which has diacetyl. So diacetyl, when it's heated rapidly, either by a microwave or by a vaping device, that chemical just irritates the doodly out of your lungs. And popcorn workers got it from breathing it, and now if you vape it, you can just directly administer it right to your lungs. It's very irritating, so be very careful. I know there's a lot of pros and cons, and people say, oh, I quit smoking by vaping. Okay, now quit vaping, because it's really not good for you. I get a lot of questions too about hookah. Hookah is no better. It's not tobacco, but aside from the chemicals and the flavorings, the smoke and the vapor damage and the heat damage will absolutely affect your lungs and your breathing. Most hookah is not filtered. So just the heat damage. That stuff burns hot, as does a lot of marijuana. So just breathe clean air. It's free, it's good for you, and in the end, you'll feel much better for having done so. So I encourage you to please take advantage of all the things that I've shown you in this little webinar, all of the online resources, anything you can get your hands on, because after all, what have you got to lose? Here's to better lung health. Thanks for joining. Bye.